Good morning. Good morning, everybody. Your Excellencies, distinguished guests, speakers, delegates, ladies and gentlemen, on behalf of Mr. and Mrs. Faisal and Juliana Zira, President and Vice President of the International Hospital of Bahrain, I extend a warm welcome to you all to our first conference on endocrine and metabolic diseases. May I remind everybody, please, if you could put your telephones on silent or switch them off. And it's my honour to introduce Dr. Ashraf Abassy, Chairman of today's scientific conference and consultant of internal medicine.
It's a real pleasure and privilege and honor to have all of you with us here in the first international conference organized by the International Hospital of Bahrain. I am sure that your presence will enrich our scientific conference today. And again, I'd like to thank Mrs. Zira and Mr. Zira for their continuous support for all these scientific activities. For the panel discussion, we will invite Professor Adel Zaki, Professor of Cardiology, Qasr Al Aini University, Dr. Ghanimi, Consultant in Internal Medicine, International Hospital of Bahrain, Dr. Shaza from International Hospital of Bahrain, Consultant OB-GYN. Thank you very much. We will start the first session.
According to the Harper study, we got new guidelines in treating gestational diabetes in Germany in the year 2011. We have, when we talk about diabetes and pregnancy, we have to differentiate between three types. A woman with type 1 diabetes could become pregnant, a woman with type 2 diabetes, and we have the gestational diabetes.
Today, I will talk about urological complications of diabetes, such as the main complication like erectile dysfunction. In this slide, you see there's about 20 to 60% prevalence in men with an odds ratio of 3 to 4.5. Another big problem in diabetes is the so-called lower urinary tract symptoms with a prevalence up to 40%, and in female, the urinary incontinence up to 40%.
Talking about metabolic neuropathy, it's a term which includes a broad spectrum of metabolic disease out of the systemic illness, which can cause a damage to the nerve itself, the nerve fiber itself. And simply to differentiate between this kind of metabolic neuropathy and the other neurogenic pain, let us imagine a patient comes to our clinic with sciatica or brachialgia, and when we investigate him, we found that there is a disc that compromised the nerve root, it compressing it. But this is not the state in that kind of metabolic neuropathy you are talking about, because the damage inside the nerve itself. In the first case, when we decompress the nerve, when we remove the disc, the nerve will subside. But in these cases, mostly the pain is felt inside the nerve root itself.
What is metabolic syndrome? This is usually a usual question asked by many people. It is a group of risk factors of metabolic origin that are accompanied by an increased risk of cardiovascular disease. This definition was modified by many institutes like the National Prestige Education Program and the American Heart Association, International Diabetes Federation, American Diabetes Association, European Society of Cardiology and Hypertension.
I'm going to speak about osteoporosis in some of the medical disciplines we face. Now, osteoporosis came to the limelight during the last 25 years. So how we define osteoporosis, we have two definitions. One of them by WHO, and the other one is by the National Institute of Health. Whatever the definition is, the ultimatum or what consequences take place due to a weak bone is fractures. And it is our job to prevent the first fracture, because this is fairly a silent disease which progresses.
So let's talk about IBD briefly. We also touched on this. The prototype disease in inflammatory bowel disease that causes nutritional deficiencies and absorption problems is Crohn's disease, because it can affect the whole gut from the mouth to the anus, and therefore all kinds of absorptive problems. And colitis can also be involved at sometimes in nutritional aspects, but not as much. In the stomach, Crohn's disease is rare, so it really doesn't affect it too much, but the duodenum, it can cause calcium and iron resorption problems. In the jejunum, as I mentioned, the folate is absorbed, leading to possible microcytic aspects of the anemia and the calcium deficiency. And this is number one in Crohn's disease, is the vitamin B12 absorption in terminal ileum, where it's present most of the time, is decreased, and a lot of those patients need parenteral vitamin D supplementation.
Are diabetics really diabetics more prone to infections? This is the first point to explore. In fact, there is wide acceptance by both medical profession and general public that diabetics are more prone to infection. Is this really true or not? A lot of studies have been done about that. Many studies have been done about that. I do not like to be boring and speaking about all these studies done about diabetes and the probability of infections in them. But the results were quite controversial according to the type of infection there. And so the investigators have reached to a division of infections in diabetics into 4 groups. The first group include these infections which were considered. The first group with the infections which are proven, which carry clear evidence of association between these infections and diabetics. The second group include infections which are considered to be having probable association with diabetes. And these are the infections in which diabetic patients constitute at least 30% of patients with these infections. The third group include infections which are considered to have possible association with diabetes. And this was defined as infections in which diabetics are from 10 to 30% of the patients with these infections. The fourth group include infections which were found to have no statistical difference between diabetics and non-diabetics. The first group that include infections which have proven association, clear-cut association with diabetes. And this included 2 infections only, tuberculosis and bacteriuria in females. The second group with probable association, as I told before, that at least 30% of patients with these infections were discovered to be diabetics. And this includes malignant otitis externa, rhinocerebral mucormycosis.
So debate will continue until the next conference will be
Coffee.
Yes, for coffee. We are waiting for the news about coffee in the next conference.
Brazilian or German, it's different.